Hey everyone, I'm Eva, the co host of a new segment of the Invisible, Not Broken podcast. I will be interviewing practitioners who specialize in chronic illnesses as well as have chronic illnesses themselves. I personally have fibromyalgia, hypermobility syndrome, and possibly some other chronic conditions, but the jury's still out on those. I'm also the co founder of Wellacopia, which helps people with chronic illnesses find their ideal medical and wellness practitioners. We consider preferences in approach to care, personality traits, details on your conditions, and of course, these are practitioners who get you, who will listen to you and look at you as a whole person. We use a compatibility matching algorithm, pretty similar to that of online dating, because after all, we are looking for that perfect someone that we will have a long-term relationship with that's best fit for our individual needs. As an Invisible Not Broken podcast subscriber, we are exclusively offering our personal services to help you find that medical or wellness practitioner, even if they're not on Wellacopia just yet. All you have to do is contact us directly. You can text us at 646-883-3022 or email us at contact@wellacopia.com. I'll be sure to put those in the show notes, but now let's get started with the episode. Hello, Melissa. Welcome to Invisible Not Broken.
Thank you. Thanks for having me.
Such a pleasure, and thank you for offering to talk to me and the community today.
It's my pleasure. Thank you.
So just to jump right in, I'd love you to tell us just a little bit about who you are in terms of being a patient and practitioner, and then let's go into your story.
Sure. I am 61 years old now. Starting when I was in medical school in my late 20s, I developed migraines. A lot of headaches, more and more headaches through the years. Then I started developing some irritable bowel and allergy symptoms. Then as time went on, in my 40s, I was getting 15 migraines a month. Even on migraine preventative medicine, I was starting to get some bad neck and shoulder pain, dizziness, then extreme fatigue. And I'm like, okay, I'm a mom of 2 young kids. I'm working, I'm exercising, I'm busy. So this is all, what is going on. Then I started getting illnesses every week from my pediatric patients. And that is totally weird, right? Because pediatricians are like school teachers. Our immune systems strengthen over time. And here I'd been a pediatrician for 18 years, and all of a sudden I started getting sick again. So nobody could figure out what I had. Then my mom started to develop severe chest wall pain out of the blue. She really hadn't had much pain to speak of, certainly not chronic pain, not severe pain ever. And it was really bad. And I couldn't figure out what was going on, and neither could her. I mean, I'm her doctor and pediatrician daughter, so she went to her internist, and they couldn't figure it out. So she went to the Mayo Clinic, and they said, "Oh, you must be depressed, and you could have fibromyalgia." So when I went to see them for Christmas that same year, a couple months later, on the dining room table was a printed out copy of a website of a fibromyalgia specialist named Dr. Paul St. Amand, who's an internist and endocrinologist at Harbor, UCLA. And they're like, okay, you're our doctor daughter, come with mom to her appointment. I'm like, sure, I'll go. And so we flew to LA, and Dr. St. Amand took a look at mom's history, asked her questions about fibromyalgia symptoms, and then did a careful physical exam. And he said, yes, you have fibromyalgia. Here are your options. Here's what I recommend you do. And then he turned to me and he said, because you have a first-degree relative with fibromyalgia, you, meaning me, are 8.5 times more likely than the general population to have fibromyalgia. He said, could I examine you? Now, you might, and 8.5 times more likely, that's huge. Let's say you have a first-degree relative with lupus or rheumatoid arthritis, autoimmune illness. You're twice as likely than the general population to have it yourself. But 8.5 times more likely to have it? That's like crazy. So I was like, sure, go ahead and examine me. And he found that I had the signature muscle spasm and swollen, contracted muscles, tendons, and ligaments that he found were diagnostic of fibromyalgia. And so then it was like, for me, it was like Alice going down the rabbit hole. Oh, chronic headaches, dizziness, chronic pain, IBS, fatigue. This all fits together. I guess this is what I have. And so then I started the education phase where I remember going to Barnes and Noble, going to the health section, sitting on the floor and pulling out all of and reading them. Of course, I ordered some too, got some out of the library. And what I found was pretty depressing. I mean, one of the books, I think it is the Cleveland Clinic book, said the prognosis for improvement or the prognosis for people with fibromyalgia is dire. I'm like, what? Dire? Like I know, that's why it sticks in my mind, because it was just so striking. And then I also read that most commonly it's treated with heavy-duty pharmaceuticals to mask the pain and sedate you so you sleep a little bit better. And then I realized that many healthcare providers don't believe it's a real condition. And I'm like, what I'm feeling is real, and I'm not making it up. So that's when I worked on a personalized treatment plan for me, which included acupuncture, which has always been super helpful for me, mild yoga, which has also been super helpful, and Dr. Saint Amand had developed something called the guaifenesin protocol that he found to be really helpful. So I went on that protocol, and it helped me really return to good health. I was so sick that I had to retire from my pediatric practice, and that was super sad, but I was so symptomatic, I really couldn't continue. So after 20 months of the acupuncture and the guaifenesin protocol, I was able to return to medicine.
And how long did you return to medicine as a pediatrician?
I never did. And so I was talking to Dr. Saint Amand, and he said, well, instead of going back to pediatrics, why don't you become a fibromyalgia consultant for children and adults? He said that I already knew from my perspective, but that I could train with him and he would teach me everything I needed to know. I was like, wow, cool. Treating adults and kids, how novel. And also, I wanted to learn more about how the protocol was working for other people, because this protocol isn't widely known, and it uses an over-the-counter medicine, guaifenesin, which is an expectorant. And so there aren't any drug company monies to do big studies on it.
Right.
So I went and trained with him, and I was so impressed with the number of people that I saw with fibromyalgia that were getting better over time, and significantly better. And from what I knew from talking to different rheumatologists and neurologists and primary care doctors, the amount of progress that their patients were making in a year was far less than many of Dr. Saint Amand's patients. I was like, yeah, well, guaifenesin gave me my life back. Why don't I pay it forward and open my own practice? And so now I'm starting my 9th year.
9th year. Woo.
Yeah, I know. Yeah. Almost a decade.
That's amazing. And it's so great that not only are you, I guess, like a hyper specialist, but in something that you experienced firsthand, both the illness at its worst and also the work that you give other people. You've been through it. You've used it yourself. And when we talked originally about both I'm going to say it right, guaifenesin protocol. Got it. It's a combination. Like, it was part of the diagnosis and also the use. I think we should talk about like exactly what that is, first of all. But also that, oh, right. Yeah. You said that the diagnosis, actually, I found that to be one of the most fascinating points. The diagnosis process of fibromyalgia and actually being very clear when to any other doctor, if they believe it's even a thing, it's like, here are some tender points. You seem to fit the bill. You are symptomatically in line with the majority of people who have it. And then maybe they do, maybe they don't. I mean, because fibromyalgia does sort of seem like an umbrella to those who don't know how to diagnose it. And also it's a comorbidity of a lot of other illnesses, right? Like, I was diagnosed with fibromyalgia first, but I also have hypermobility syndrome, hopefully not EDS, but definitely some joint stuff. And I'm almost certain I had the joint condition first.
Yes.
Even if I was diagnosed with fibro first. Yeah, you're in California. I'm in New York. I kind of wish I was in California so you could do the physical exam on me. Because even though I do fit the description.
Didn't I hear that Wellacopia might be launching in California in the future?
Oh, yeah, absolutely.
There you go.
Well, I definitely want to get over there. Oh, yeah, we have definitely a number of practitioners down in California and a number of patients in California. And something I believe I've mentioned in other episodes is that we're actually starting to grow in pockets around the country too.
Very.
Oh, yeah.
Yes. You're absolutely right about me, because I have fibromyalgia, knowing what it felt like for me and continues to feel like for me to have these symptoms. Before I was diagnosed, and I was just so sick with chronic widespread pain and all those migraines and dizziness. I remember when I was still working, if I wasn't careful, if I would turn quickly away from the child to go get the otoophthalmoscope to look in their ears, I'd get so dizzy I'd almost hit the floor.
Whoa.
And there were some times where I was so sick, I thought surely I must be dying. And the doctors couldn't figure out what was going on. And I just hoped and prayed that I would live until my youngest child was 7. Because I thought that at that age, she would remember me and remember the love I had for her. So I've been through those dark times. And so I can identify with patients who have been through those dark times too. And, I'm so much better. And that's a possibility for all of us with fibromyalgia to get better. And so the guaifenesin protocol, such a big gift for me. And so my mentor, Dr. Paul Saint Amand, who just turned 92, he is still in full-time practice at Harbor UCLA as an endocrinologist, internal medicine doctor, and fibromyalgia specialist. He spends most of his time doing fibromyalgia consulting, though. And so in the 1980s, he started to see a lot of people in his office that had chronic pain. And he did a careful physical exam on these patients. And he found that they had swollen, contracted muscles, tendons, and ligaments, which are throughout our body. This is what gives many of us with fibromyalgia, the rocks in our shoulders that
Oh yeah. You mean my wall of rocks? The
exactly.
wall of my back. I definitely identify with that, that's for
That
sure.
massage therapists are like, okay, all we've got to do is really loosen this up. And it might help for a little while, but then
I shocked a few of them. They were like, wait, what? What's going on here?
me too, they're like, um, and so he found that we have these swollen, contracted muscles, tendons, and ligaments throughout our body, and that we all have little tiny swollen, contracted muscles, tendons, and ligaments down our left anterior thigh. And that was diagnostic of fibromyalgia. And the way he knew that is that he examined 2,000 people who had been diagnosed with fibromyalgia by a rheumatologist or a neurologist, and they all had these little bumps. And usually the little bumps are so small and they don't hurt. But he was like, wait a minute. Then I can diagnose with 100% certainty whether someone has fibromyalgia or not. And that's so cool, right? And speaking of like EDS, so I remember a couple years ago, there was one patient who then started a little migration of EDS patients to see me. She said, I know I have EDS, and now my doctor says I have fibromyalgia as well. I don't think I do, but they want me to go on different pharmaceuticals to treat fibromyalgia. Can I see you? I'm like, sure. And I saw her. She did not have the swellings in her left anterior thigh. I'm like, don't worry about fibromyalgia. You don't have that. Concentrate on your other things. So it's really so nice to, one, be able to diagnose it with 100% certainty, and two, to be able to tell someone if they don't have it.
Yeah, that's really remarkable. Like if someone came to me, I'm not a doctor and I'm not an expert, but just from experience and knowing people, if someone with EDS came to me and said, I think I have fibromyalgia, I'd probably be like, you probably do. I mean, like it's usually comes with autoimmune diseases and you're probably fatigued and lots of have neuropathy. And I'm like, yeah, maybe. But,
Yeah.
and that's just frustrating. First of all, it would be incorrect in this case. But also it's like, so like as someone with fibromyalgia myself, sometimes I even get discouraged at this point, and it's like I'll give the air quotes, like I have fibromyalgia.
Right.
It's almost like I'm acting like one of those doctors who doesn't believe. And it's like I obviously believe in what I'm experiencing.
Yes.
But do I have fibromyalgia? Sounds like I do. from
Well,
what we've yeah.
right. And the reason that it's important is because if you don't have fibromyalgia, then you can concentrate on treating the conditions you know that you have. If you do have fibromyalgia, then you can concentrate on what works best for fibromyalgia. And sure, things like exercise and proper hydration and mind-body therapies work for all conditions. Yeah,
A big water bottle, right?
exactly. But there's certain specific things to know about fibromyalgia and how to treat it that can be super helpful if people know that they do have that condition.
Yeah,
And
and also not taking drugs, especially. Like if you're going to take
absolutely.
Lyrica or something and you don't actually have fibromyalgia, I don't even, well, my personal opinions are don't like Lyrica. But if it helps people, I'm happy. Good for them. Fine.
Me, me too. But yes, and so everyone needs to decide, knowing what their true diagnosis is, what types of medications and supplements and different types of treatments they want to pursue. And so for me, getting the diagnosis of fibromyalgia, I was like, no, I what I want is to find the most effective treatments that have the fewest side effects.
Makes sense to me.
And I took a look at the studies on Lyrica, Cymbalta, and Savella, the 3 FDA-approved medications for fibromyalgia, and saw that if you take a look at the data out 6 months after people start, they're no different than placebo. So they might start working initially, but at 6 months, they're no better than taking nothing, but they have a lot of side effects.
Yeah. Can we actually talk about the placebo effect for a minute? Because this has really been on my mind lately. I just watched the documentary Heal, which is on Netflix. I don't. Did we talk about this? Have you seen it?
No, I haven't seen it.
You should see it.
Oh, I'm writing that down right now.
I highly recommend it to everyone, regardless of what you think at the end.
Yes. Okay.
It focuses on how do I say this? Like, you can manifest health from your mindset, in short. And I'm aware that that is a complex thing because there's so many factors in that. However, obviously, we've seen time and time again that this can be the case. I mean, even in Eastern medicine. But the reason I bring this up now is because as I was watching this video, I've always thought that the placebo effect is a phenomenal type of treatment, because at the end of the day, if it works, it works. So when people ask me, let's say, because we have medical and wellness practitioners on Wellacopia, so we do have some Reiki practitioners, obviously acupuncture, so on, and they'll say to me, well, what if, we can't find proof for them? And I say, well, obviously they work for some people and they definitely don't hurt them. So in my book, regardless, and there are enough studies on them, I'm very happy, because if they help people, they help people.
Right.
But I guess I said it in a negative light, which was, if it's placebo effect, still good with me. And placebo effect has this negative air about it, like, oh, it's not real.
Yes.
But what placebo effect is, it's actually just mindset manifestation. That's a positive way of looking at it. Someone decided whatever is happening to me right now is going to help me.
Yes.
And then it does.
Yes. And that's awesome, right? I'm all for the placebo effect.
Yeah, but it shouldn't be the placebo effect. It should be like, okay, doctors, I've mentioned this many times. My husband is a doctor and he's in a fellowship. So he's like really in the throes of it right now. Research is everything.
Right.
And we watched it together. I love getting his perspective, being such a standard medicine guy.
Yeah.
And he's like, well, yeah, a lot of the time the placebo effect is just as effective, if not more.
Yes.
Than some. So
the 2 things about that. The only problem with talking to people, and I'll just talk about fibromyalgia, about the placebo effect and how effective it can be, is that it puts pressure on them that, all right, they just have to be better at the mental part and trying to kind of get the placebo effect rolling so they'll feel better. So you see what I mean? It's like, oh, you're not better yet? Well, come on, get your mind with the program and, kickstart the placebo effect. So, but what Dr. Saint Amand found with our abnormal physical exam is that these swollen muscles, tendons, and ligaments press on nerves that can cause pain. We have an abnormal physical exam.
yeah.
So there may be limits to what a placebo effect can do.
Oh, of course. I mean, I think it's so varied. So I'm not saying to people don't take medications or don't do certain therapies, but it shouldn't be overlooked at the same time. There's definitely physical things going on with this. And I don't even just mean pain. I mean like the rocks in our back that we spoke about. It is actually, so what you're talking about really is something that bothers a lot of us with invisible illnesses, which is people can't see it. Right.
Exactly.
But they can, or at least feel it. That is physical.
Definitely.
So you're actually going against what everyone says. You're like, guess what?
Yeah.
You can actually feel it.
I'm going against with what everyone says. except the people who have been examined by someone who's been trained by Dr. Saint Amand or me and been mapped. That's what we call it when you are mapping, when you are feeling those areas. And so when I do an evaluation, a new patient evaluation, I spend a lot of time on past medical history, get the symptoms, and then I examine someone. And I have a little blank figure, and I will color in dark circles where I find the swollen contracted muscles, tendons, and ligaments, and muscle spasm throughout the body. And then if they want me to send the information to their healthcare team, I send them the map. And I'm like, look, their physical exam is not normal. It's consistent with fibromyalgia. But, it's interesting to me. A lot of my patients say that their doctors don't touch them. So they haven't been taught how to examine someone with fibromyalgia and compare it to normal. And one of my favorite things is to have healthcare professionals in my office and mapping a bunch of fibromyalgia patients with me, and their eyes, become big, and they're like, oh my God, I can feel them. I can feel. And one of the largest areas of swelling is around the inguinal ligament area, where most of us have very, very swollen inguinal ligaments. And some of my patients their doctors have had them go through surgery to have some of these swellings removed.
Really?
Yeah. And of course they grow back because it's part of the fibromyalgia syndrome. But yes, the fact that knowing that in fibromyalgia, our physical exam is not normal, that's huge for people with fibromyalgia to be like, yeah, I get it. It's not just in my head.
Oh, hear that? We're not going crazy. Not like,
Well, we might be going crazy, but
we're going crazy because of it.
Right, exactly.
I think Monica has said this. I don't know the statistics on it, but like a good number of us, I'll say, have legitimate PTSD because of fibromyalgia or invisible illness in general, because we're experiencing such horrible pain and abnormalities, and people think we're lying. We think we're lying sometimes. Like you said, it's like, oh, what's going on with me? This isn't normal. I hope I live. I don't even know if this is like a terminal situation. And you go a little nuts.
And also to be made felt that we're either depressed or stressed or lazy or crazy. These things can these are not good ways to feel. But I remember a couple years ago, I had been treating a teenager with fibromyalgia. Her parents were super supportive, and then a couple years after the teenager was diagnosed, her mom developed fibromyalgia symptoms, and she was like, "Oh my God, I had no idea this is what it felt like."
Oh.
So even though she was super sympathetic, she couldn't be empathetic until she got it. So, I try to understand healthcare practitioners who think it's all in our head, and I say, they have just not been educated yet. They just don't know what the physical exam is like, and they haven't felt the feelings that we feel in fibromyalgia. That doesn't absolve them of how they might treat us poorly, but it's amazing to me how many of us can be so tired and be in so much pain and still be upright.
It is amazing. For example, our co-host, Monica.
Absolutely.
He is so many words.
Yeah. And so that's
Lovely
crazy,
one.
right? That we are so symptomatic, and we are willing ourselves to get through the day, and we're called lazy and crazy. So there's this disconnect. And so one of the things that I try to do with my new patients and all of my patients is to validate their symptoms and to empower them to really find their tribe of people who really can support and understand them, and get a healthcare team that can really do that for them. Because fibromyalgia is real and the symptoms are real, and there's hope for everybody with fibromyalgia to get better.
Well, thank you, because I think that's something a lot of us need to hear. We feel like it's just something we're stuck with and something we have to deal with. And in some ways, it is always going to be something that we deal with.
Sure.
But like, it doesn't technically go away, but it can be asymptomatic, or you go through really good periods. It's ongoing. Like right now, I've been doing pretty well myself because I've been taking care of I've been listening to my body and really doing what's been right for it. But I know that there's going to be a point where that's not as much the case.
Absolutely.
I
Yes.
have to go back to doing what I do best, hopefully.
Yes, absolutely. You know, I found an analogy I like. Let's think of another chronic invisible illness like fibromyalgia that has a strong genetic component. Type 1 insulin um, dependent diabetes.
Great.
So would you say to someone who has type 1 insulin dependent diabetes, you just need to rest? This is all in your head. You just find the placebo effect, just chill out. No, they need treatment. They need insulin. Their fibromyalgia is exactly the same. Chronic invisible illness with a strong genetic component.
That really is news to me, by the way. I think I've started to see a bit of a pattern, and possibly my sister, but I haven't told her that yet because I'm observing from afar, just like, nodding my head like, shit.
Yeah. Well, I'll give you a tip. The way to know, one way to know in the older folks is that Dr. Saint Amand and I have found that everybody with fibromyalgia develops osteoarthritis later on. Not rheumatoid. Rheumatoid's autoimmune, but osteoarthritis. And one of the cool things about guaifenesin, other than helping a lot of us feel better, is it stops the progression of osteoarthritis. So, and this osteoarthritis, especially in our C-spine, and as the spine goes down, it can develop early, like in the 20s. So I remember seeing a woman at a 4th of July party a few years ago, and she looked to be my age, and I saw that her joints were swollen. I didn't know her. We were at a big table, and some of my friends were talking to me about how my work was going and mentioned fibromyalgia. And then later on, she came up to me and she said, "Can I ask you something?" And I said, "Yeah, do you want to ask me about your chronic pain?" And she was like, "How did you know?" So because osteoarthritis is not normal to develop in the human body. So, take a look at your older aunts, uncles, parents, grandparents, and if they have, the swollen joints, or if they have been diagnosed with rheumatism, or if they've got chronic back pain, they could have mild fibromyalgia. And it's probably about 10% of the population. So,
yeah, last statistics I saw on it were 10 million Americans.
yeah, and it's underdiagnosed. It's probably much.
Yeah. So you weren't ever diagnosed with anything else?
Right? Well, yeah, I have allergies, and I've had Epstein-Barr too in my body. Yep, and I have some mast cell activation
Oh,
too.
really?
Yeah,
Oh,
which is very exciting. Yeah. So I'm hypermobile also. Not like you. I can only like get my finger back this far. But I do have some hypermobility issues and really have to watch my posture. Otherwise, I'll get neck and shoulder pain. So those are the things that I'm basically dealing with now.
yeah. I'm sure there are people, I guess, with just fibromyalgia, but I found it to be rare, or there's things they haven't uncovered yet. Because it definitely tends to be paired or grouped with a lot of different things. And really, I think that could even just be, I mean, you tell me, you're the fibro expert, um, uh, anxiety or depression. I don't know if I said the word just. I shouldn't say just. I guess I meant by like mental illness versus uh, something that manifests physically, but mental illness does actually manifest physically. I'm kind of answering my own
Yes,
situation here.
absolutely.
But it's chronic stress, right, on the body.
Right. It's chronic
So,
stress on the body. So yes, there are central nerve. So if you take a look at the the symptoms that occur in at least a third of people with fibromyalgia, the central nervous system symptoms are fatigue, anxiety, depression, non-restorative sleep, trouble with concentration, and memory. Um, so these happen in a third of people with fibromyalgia. And so people can have underlying depression or anxiety, but fibromyalgia fuels the flames of that.
gotcha.
So it's been so cool to see in my treatment of fibromyalgia how the anxiety and depression and non-restorative sleep and trouble with concentration and memory decreases in intensity. Um, and so that is a part of the fibromyalgia constellation of symptoms other than body pain. So that's something that definitely needs to be recognized. But to address your question, so what I do when I see someone with fibromyalgia, especially if they have a lot of fatigue, I want to make sure that they don't have hypothyroidism because that can add to the symptoms of fibromyalgia, that they don't have anemia, that they don't have Lyme disease, that they have normal kidney and liver function, and then I want to make sure that they don't have obstructive sleep apnea because it occurs in 45% of people with fibromyalgia, even without the risk factors of obesity or snoring. So 21% of all people in the US have it, but if you have fibromyalgia, it's 45%. And when I saw the study of it's like 594 patients that, half had fibromyalgia, half didn't, and they had sleep studies and it showed all this obstructive sleep apnea. So now I have all of my patients 30 and over ask their primary care doctor to order a sleep study. And my 30 somethings say that their primary care doctors, like, they're grumbling when they're writing the, and sure enough, what do I find? 45% of them do have obstructive sleep apnea, just like what the study results show. So if you are not getting enough oxygen to your brain and your body at night, of course you're not going to feel well.
As far as I'm aware, I don't have apnea. I could be in the other 55%,
Yeah.
but
Yeah.
I guess we don't know. I definitely have non-restorative sleep.
There you go. So, and yeah. So just something to think about. And a lot of people, when they think about obstructive sleep apnea, are like, oh my God, there is just no way that I can wear that mask and the noisy thing. Well, I've come to learn that a lot of times the first treatment, depending on what the sleep study shows, is a comfortable like night guard that opens your mouth just a little bit to allow more oxygen in. So, but also, if you have chronic pain and non-restorative sleep, it's probably a good idea to know what your sleep is like with a sleep study. So you can, if you want to do something about it, meaning, do you want to pursue different kinds of treatments with the sleep specialist, then you can.
Very true. So far, I do have one of those apps that monitor my sleep.
Yeah.
So that does help a bit. And I have a really good bed for it too. I have a, what do you call it? A Tempur-Pedic,
Oh, good.
which by the way was like half a present that my parents got me when I was diagnosed with fibromyalgia. When I was diagnosed when I was 20, they were like, what can we do? And I said, help me buy this bed.
Yes, that was so great. I mean, it's much better than cocaine or, somebody says, I really think it probably lasted longer and, helps
Oh
you.
yeah, it's lasted 8, 9 years. So I love that bed. Yeah. Oh, okay. So before I forget, I really want to learn more about what the protocol entails. Like I know there are different steps to it.
Yes.
Because I'm sure a lot of people listening have no idea what it is. I didn't hear about it before you. So
Yeah, and that's the sad thing, right? Because they're, again, it's an over-the-counter medication, and so there isn't drug company. You're not going to see an ad for the guaifenesin protocol during the Super Bowl. There just isn't that kind of money. But the best way to find out is this wonderful book, What Your Doctor May Not Tell You About Fibromyalgia, by Dr. Paul Saint-Amand. And it's my favorite general review of fibromyalgia itself. So you can learn more about what fibromyalgia is and isn't, and then a specific review of the GUI protocol. And going on my website, melissacongdonmd.com, or Dr. Saint-Amand's website, fibromyalgiatreatment.com, it takes you through the specifics of the protocol. And on Dr. Saint-Amand's website, there is a link to an online support group. Claudia Marek, who's his medical assistant and co-author of his book, has an email support group where if you sign up for it, you can ask questions, she can get you started, and there are tons of great Facebook groups, like Fibro Fighters on guaifenesin. So they help people who can't get in to see Dr. Saint-Amand or me learn the steps of the protocol. So there's a lot of support out there. But the first thing is get the book from the library, order it on Amazon, either Kindle, or the paperback version, and get yourself educated. That's the first thing. And then you'll learn the right type of guaifenesin to buy, which is the long-acting, dye-free. And there's a wonderful place called the Fibro Pharmacy at fibropharmacy.com. And they sell the type of guaifenesin that you need to buy. And so the whole reason why it works is that Dr. Saint-Amand found that when people take guaifenesin, their kidney excretion of phosphate is increased by 6 times. So he hypothesizes that even though our kidney function's normal, our kidneys are a little sluggish in excreting phosphate. And maybe that's what is in part of these rocks, right? If we have excess phosphate in all the cells in our body, you remember from high school biology? What do the mitochondria make?
yeah.
ATP.
Yeah, wow. That's yeah, I was gonna say, how did he figure that out? But yeah, actually I can see sort of the downstream effects. Huh.
Definitely. So that guaifenesin allows the kidneys to excrete phosphate, and over time, the nodule, that's the swollen muscles, tendons, and ligaments, decrease in number and size, and over time, we feel better. So it's simple. You have to be educated to finding the right type of guaifenesin and the right dose, and avoid products that block its action.
Right. That seems very important. So it's very, yeah, it definitely should be noted, especially now on the podcast, that it might be an over-the-counter substance, but it cannot be used willy-nilly. It's not like going to the drugstore and buying some vitamin B12 situation. Like it is very particular, like you said, with, I mean, I want you to talk about the inhibitors, as well as like it can be a little dangerous, like if you do too much, too little, something. I don't want to say.
The only danger is that you could make your symptoms ratchet up.
Ah,
But
yeah. Not actually dangerous, but very unfortunate.
unpleasant. Yes.
Unpleasant.
Yeah, absolutely.
Yeah.
Absolutely. Yes. There are only a few simple rules to making progress, decreasing your nodules on the protocol, but you have to follow them exactly or your guaifenesin won't work. And so the first one is finding the right type of guaifenesin. And some people can get away with using Mucinex, even though it's not all long acting and it does have blue dye, but a large proportion of the population, blue dye gets into our mitochondria and inhibits energy production, and that medication doesn't work for us. And so the Pharmacy sells guaifenesin. It's inexpensive, certainly compared to most things. It's about $60 a month. And I write prescriptions for my patients who want it because then their FSA or HSA will pay for it. And so go to the Pharmacy and get the dye-free compounded guaifenesin. And then it's important to understand that you can eat anything in normal food quantities. But if you take herbal extracts, they block the action of guaifenesin. So if you can imagine the kidney and a little receptor site there, echinacea and other herbal products fit better in the receptor site where guaifenesin works, and they stick there for 24 hours. So let's say you think you're coming down with a cold. You take echinacea, and a half hour later you take guaifenesin. It's not going to work decreasing your nodules that day.
Gotcha.
And so you have to take a look at your oral products. And one of the things that people often miss without me or the support group leaders telling them, tea is an herbal product. What is a bunch of leaves? It's more than a normal food quantity. So you can make your own tea with a little slice of lemon, a little slice of orange, bit of fresh ginger, some cloves. But if you buy tea in a bag or just the leaves, it'll block guaifenesin's action. And if you use plant oils, gels, and extracts on your skin, other than corn, rice, oat, wheat, and soy oil, then that blocks guaifenesin too. So, yeah, I mean, but luckily there are tons of healthy and wonderful products that I can help people find, and so can Fibro Fighters on Guaifenesin Facebook group and Claudia Marek's email support group, the Guai group. There are so many wonderful healthy products that you can use that don't block guaifenesin. And so it's, for me, it was like, okay, yeah, I missed my old favorite shampoo, but I don't miss the 15 headaches a month. Right?
Yeah, like weighing the pros and cons, I think one becomes more obvious than another, of course. And if that's the thing you have to change, it's not as big a deal.
But it can be overwhelming at first. And that's why the Fibro Pharmacy has something called a startup kit, where they offer your guaifenesin, shampoo, conditioner, and lotion, deodorant, toothpaste. Mint is a big blocker of guaifenesin. So most toothpaste contain mint. So what a lot of people do is they get the startup kit, and they make sure that that's what they start with, and then they add products as time goes on.
That's a smart idea that they made that sort of niche market, so it's not as difficult for people to go out and find.
Yeah.
At the same time, I feel like I should mention this. So Monica always says, none of anything nothing on the podcast should be taken as medical advice, because we're not doctors. We don't pretend to be. You are actually a doctor. But at the same time, I guess the disclosure should be that I don't think anyone should take this advice without consulting like Melissa or the literature. I wouldn't just from here and then
No.
immediately go do things.
No.
Yeah.
Talk to your physician first. Say, I'm interested in starting the guaifenesin protocol. I've read the book. I have been to Dr. Congdon's website, Dr. Saint Aman's website. This is what I've learned, and this is what I'd like to do. And get their input on that.
And of course, they can always reach out to you personally, right? I mean, you are.
Absolutely.
This is what you do. And you're a pioneer in this. Ooh, that reminds me of the other thing I wanted to ask. So you were talking about how you brought in other physicians who maybe
Yes.
were like non-believers in fibromyalgia and the diagnosis and whatnot. You brought them in and showed them the map. Have you done videos on that? Because I feel like that would be a good idea. to show other doctors,
Yes.
watching them do what you do, and then their feedback on it.
Yes. And I can, the next time I do a mapping seminar, I can certainly ask those healthcare providers if they would mind being, filmed. The nodules are more easily felt than seen on a video. But yes, I mean, watching the physicians' faces and hearing them say, "Oh yeah, oh yes, I feel that. Oh yeah, now I understand what you're talking about."
Yeah, somehow voicing exactly what's going on and what they're learning. And I don't know, it was just an idea, but all I keep thinking is that, as true for all good ideas, this should spread, that there is another way to the very least diagnose fibromyalgia, and hopefully the guaifenesin I practice this reading. Guaifenesin protocol is good for all, if not most people. But regardless, anything, in my opinion, that helps people and doesn't hinder should be known, and that word should be spread. So, and I can help you with that offline if there's any way that I can make that well known, because as someone who has fibromyalgia myself, and the diagnosis process has been very wishy-washy.
Yeah.
Yeah, that should be put out there.
And that's one of my goals too. My biggest dream is that when someone is diagnosed with fibromyalgia, that in the toolbox that the doctor gives them for possible treatments, the guaifenesin protocol is listed in there. Now it is an antidepressant, or gabapentin, or Lyrica, Savella, maybe Cymbalta, and maybe a muscle relaxant.
Mhm.
Let's expand that a little bit more to guaifenesin, and you know how magnesium, how well it works in Epsom salts.
Fast. I was so surprised when I heard that at first. I was on a Facebook group and I asked people, what's like a natural remedy you guys do? And a lot of them would say Epsom salts. And I was like, what? And then I looked into what Epsom salt was, and it's magnesium. And aha, it makes sense now.
Yeah.
Yeah.
And so that's what I do with patients, is that, I open up this huge toolbox and I'm like, all right, let me tell you the things that can work for people with fibromyalgia. What resonates for you? And I help develop a comprehensive, personalized treatment plan. So the goal is that as the toolbox should be really, really big, and the person should be able to choose.
Well, I'm all about personalization. That's everything I've done in my life, my professional life. I mean, Wellacopia is literally matching based on the best fit person for you as an individual. So personalization, where it's at. We do have to wrap up in a minute, but before we do, I wanted to know if you could tell us a story or two about a couple of patients that you've worked with.
Sure. One patient that comes to mind is a woman named Stephanie, and she was in a documentary I produced a few years ago. I wanted to thank Dr. Saint Amand for developing the protocol, and since he's getting up in years, I wanted to do it while he was still alive, right? Thank him. And so I hired a local filmmaker to come to my office and film a number of patients tell their stories about how they recovered on the guaifenesin protocol. And it's called Fibromyalgia, Getting Our Lives Back, Success Stories on the Guaifenesin Protocol. And it's on YouTube. So Stephanie is a wildlife biologist and started developing chronic pain in her 20s, and really, really was severe. And she tried to push through. She found that being outside and moving helped her, and she found being in warm weather helped her. So, wildlife biologist, that was like a perfect job for her. Then it stopped working so well, and the doctors really couldn't figure out how to help her. And they said, well, you just must be one of those people with pain. And she started the guaifenesin protocol. And I remember getting a call from her Feldenkrais practitioner, who was also doing body work. And he said, now I know the guaifenesin protocol works. Stephanie, he said, I've been treating Stephanie for years. She's been on guai for 9 months. Her muscles have totally changed. They're soft now. They're more mobile. So anyway, she gets better. And that's okay.
I turn off everything but not my alarms.
That's all right.
God.
That's okay.
A wonderful story you're in the middle of.
Interrupting my Stephanie needs to be heard.
Okay, go on. Sorry.
So Stephanie starts guaifenesin, and she starts feeling better. She starts being able to do more things without pain. And she's finally able to contemplate getting pregnant and having a child. And she was able to do that. So she brings the little guy in to the day that she was being filmed, and there's her 6-week-old child. And so, I mean, to have someone feel better, get their life back, and to be able to really achieve one of their dreams is awesome. So
yeah, I can't imagine anything better than impacting someone's life that way. It must give you so much joy every day.
Definitely, it really does. And yeah,
even just doing it for one person, you know.
Yeah, right, exactly.
Fabulous.
Well, with kids too, that's fun. It's fun helping kids feel better, because a lot of most pediatricians will not, even though they think a child has fibromyalgia, they'll call it an amplified pain syndrome because they don't want a child labeled. Mm-hmm. But studies show if they can get treatment, and the guai protocol works so well and so fast in kids, then kids that have chronic pain and fatigue or trouble with concentration and memory, they're like better so fast. So that's really fun.
God, kids adapt to things so fast. Lucky them.
Lucky them.
Lucky them. Yeah. Some things are better when you're older, some things are not.
Definitely.
Yeah. All right. Well, I think this is a great place to end. It was such a pleasure having you on. You're so inspirational, educational. Like, I learned a lot. Hope everyone else did too, listening. We'll definitely have show notes, answers to some of these questions, as well as the links that you spoke about and how people should contact you. And if anyone wants any more information that we haven't talked about, let us know in the comments. All right. Well, have a fabulous evening in your warm weather. I'm going to go enjoy the snow. All right. Thanks so much.
Thank you. Take care.
You too. Thanks again for listening to another episode of the Invisible Not Broken podcast. I'm Eva, your new co-host and co-founder of Wellacopia, the matching platform for chronic illness patients and practitioners. I hope you enjoyed this episode. And as always, be kind, be gentle, be badass.